Hi, this is Casey Grimes, and this is my Med Map. So, a little bit about my patient. She was a 64-year-old female. She had just had a left total knee replacement. When I was her student nurse, she was 12 hours out of post op from her knee replacement surgery. Her pain throughout the day was about a 3 out of 10, which was comfortable for her. She did not want to go over that pain. She was very worried to become more in pain throughout the day and also when she was discharged home. She did have a little bit of a health history. She had anemia, she had a previous colectomy, hypoparathyroidism, and depression. So, a little bit about my patient's meds. She was taking Docusate. This is because she was on tramadol and had received some more pain medications during surgery, so we were trying to prevent constipation with her. Ibuprofen, this is for mild to moderate pain and it also decreases inflammation. Inflammation can happen with total knee replacement, so it's important to stay on top of that so we do not get pain. Tramadol is for moderate to severe pain. It decreases pain from the total knee replacement. For her, this is more of a PRN medication. She did request this the second day towards the end of the day just because she did get in a little bit more pain. But once she took it, her pain went back down and she was very satisfied with that. Iron polysaccharide. So, this is a home med for the patient. It's for her anemia. And we had kept her on this while she was in the hospital. We did not discharge it. Ribofloxacin, this is what they give patients who have just undergone knee replacements and hip replacements for the prevention of like blood clots. The biggest thing with this med is that it does cause bleeding. So throughout the day, we had to do a lot of assessments for bleeding, making sure when she got up to ambulate, she was always with someone and not ambulating on her own in case she did fall, because that fall could lead to a bleed, and other injuries that could lead to a bleed as well. And then levothyroxine, this is for her hypoparathyroidism. Again, this was another home med that she had brought in that we did keep her on as well. There were some interactions with these medications. The biggest one I realized is that she was at a risk for fall. And that is because her iron polysaccharide caused dizziness. Her tramadol caused dizziness as well, as long with her ibuprofen. So these three taken together puts her at a higher risk for falls on top of just having a knee replacement surgery. So that was a big risk to look out for. We definitely don't want falls, especially being on ribofibraxone, because that could just lead to more harm to the patient. Let's see, another thing is that multiple of these medications caused a lot of CNS effects. So, my biggest thing with this patient is that we need to get a baseline CNS assessment on her. We need to know what her baseline is because looking at this, we can see that ibuprofen and tramadol and levothyroxine, these all cause CNS changes like irritability over here, anxiety, somnolence, confusion. Let's see, right here, psychic disturbances. So with this, we want to know what her baseline is to see if she's deteriorating at all. So if she is deteriorating at all, we can assess and see what's going on to cause this deterioration. And it could also just be these medications all coming together and causing this to happen. The next thing is she was taking multiple medications that cause vomiting, diarrhea, and nausea. So a big risk factor for this is that she could get electrolyte imbalances and dehydration from these medications. So, I mean, many of them did. Docusate causes diarrhea. We have ibuprofen, which is the vomiting, abdominal discomfort. Tramadol, which is diarrhea, but it also causes constipation as well and vomiting. Let's see, we follow this down here. Diarrhea again for levothyroxine, and then vomiting for iron polysaccharide. So again, all these cause these things to happen, and this is a big factor for if she's having all this happening and it's happening too much, she could get possible electrolyte imbalances like loss of potassium, or she could get dehydrated, especially being after a knee replacement surgery. That's not something that we want to happen. Let's see. She also was taking two medications that stood out to me that caused arrhythmias. So ibuprofen can cause arrhythmias as long as her levothyroxine. So this can cause ECG changes. So it's good again to get a baseline ECG just to see where she's at. And then if there are any ECGs appearing, it could be because of these two medications taking together causing changes. If she starts feeling palpitations, it could also be because these two medications are causing arrhythmias that are causing palpitations to the patient. So it's one thing to be aware of when taking care of this patient. And then we also have this patient is at risk for bleeding because of different medications. So ibuprofen, GI bleeding, that's a big one right there. And then we also have the bleeding for ribothyroxine. So hemorrhage is a concern here. We definitely want to keep taking assessments to keep seeing if she's got extra bruising, if she's maybe bleeding from her gums, if she brushed her teeth with a hard toothbrush, anything like that to see if she's bleeding. And then also checking our hemoglobin and hematocrit levels to assess for any types of GI bleeding. And also to go with that, it would be like the change in the level of consciousness to see if she's got any bleeding happening too. Maybe she's become more lethargic because of it, or her heart rate has gone up. That could be a sign as well. So these are just the different things that I saw that kind of that stood out to me that could interact with each other and cause some potential risk factors for this patient. But yes, this is my med map. I hope you enjoy it, and thanks for watching.